Good morning, Las Vegas. It's Zandra Pollard. It's where I am. Today, we're talking about sex. Madison Gully is a licensed professional who deals with relationships, and her specialty is sex. So, how did you get into sex?
Well, thank you for having me here.
Of course.
I'm very excited. Uh, you know, Sex has always been something that comes really comfortable to me and talking about it. So it was, I worked in the medical field prior, so making the transition to therapy, talk therapy, really became, it was a natural transition in terms of health care, right, and healing. But then in regards to my specialty, becoming a clinical sexologist, it really just seemed like a great fit for me, talking with people about sex, the most intimate part of an individual's or couple's lives. And I just found that I'm really great at having a connection and building a connection with people, and then to be able to ask such intimate questions right from the get-go is important.
So, how do you start those conversations? Like, how does it go? Like, how's your sex life? Like, how does it start?
Yeah, pretty much just like that.
Really?
Yes, except usually I'll ask, well, I get a little bit of information about why they're calling to inquire about my services.
Okay.
And then once we kind of make that initial phone call and we set an appointment for a consultation, really, I give people two choices. A standard kind of initial assessment is for therapists to ask a ton of questions. It's called a biopsychosocial.
Okay.
And that also, for me, includes a sexual health assessment, like a sexual wellness assessment as well.
Oh, I wonder what that's like. Okay. Okay.
But sometimes going through all those questions can be daunting for people. So I really give them a choice, and I ask them if they're comfortable just telling me why they're here, and we'll have a conversation.
Okay.
And then if we get to it, it's probably within 5 or 10 minutes that they'll tell me why they're there.
Okay.
Yeah.
Well, I had a couple of relationship experts on the past few weeks. I had Dr. Mullen on, and then I had the number one relationship coach, C. Reggie Rogers, on, and they gave some great information. And it was kind of like when I talked to my girlfriends, right? It's so easy to talk to your girlfriends about sex. But when it's time to talk to your partner that you're having sex with, then we want to clam up and we don't want to discuss things, right?
Correct. Absolutely. Absolutely.
Yeah, so anyhow, having them on the show helped me deal with some things in my relationship. But I talked to a really close friend of mine, and she told me years ago, she says, Andra, I really think, you and your man need to see a sex therapist. And I said, really? And as years have passed by, it's like, I think she's right. It seems like a lot of our issues boil down to our intimacy. So for me, sometimes it's just like, you know, it's sex, it's sex, it's sex. And for him, sometimes it's now that we're older, for him, it seems like it's more conversation or hand holding or something, or just watching a show together, those kind of little intimate things.
Yeah.
So, what do you say to people who are middle aged and sex is changing, whether it's for the female or the male? The libido shifts. Right?
Absolutely. Yeah, absolutely. Well, yeah, that's quite common. And what I find is people struggle with that change because it either happens gradually and they don't notice it until it's been going on for a few years, or it's rapid, it's quite quick, and they don't really feel like themselves. And when you're in a couplehood, that disrupts the couplehood, and people don't know how to talk about that. Sex is a hot topic, and sometimes along with it being a hot topic, it's also a delicate topic.
Yes.
So then, nobody wants to hurt their partner, nobody wants to offend their partner. and they're not quite sure how to say what they want to say, so they dance around it.
Right.
And that leads couples down a rocky road.
Mm-hmm.
And they might spend a few years on that rocky road, and they don't have to. Couples
And
just
that's a
don't
lot
have
of
to.
sex you're missing.
Absolutely. Yeah. Well, and also too, what I found is as we get older, that we really fall more into ourselves, whether it's our skin, our relationships are more comfortable, maybe kids are getting a little bit older,
Okay.
and we're more secure in our jobs. It's not like when you're in your late 20s, 30s, where it's really the hustle of either your career or starting a family. That's typically when people do those things. And so when you get into your late 30s, early 40s, you're like I said,
like me.
Yeah, well, I'm in my late 40s.
Mm-hmm.
And so things do change, and sometimes people don't know how to reconnect. And like I said, they dance around the topic and they don't really get there, and they're afraid to hurt each other's feelings, and
because then they think they won't get
laid.
Right.
Yes.
So how do we start the conversation? What do I say to my partner when I'm kind of ready and he's not? Because we do have like
ready for the act or ready for the conversation?
Both.
Okay.
Let's start with the conversation. Because I think for us it's a power struggle. You know what I mean? Like either I want to be super dominant or mostly he does.
Gotcha. In the conversation.
Well, that's a sexually putting that out there. But then now, how do we have the conversation about doing something different? Or, one being more dominant the next time than the other.
Yeah.
Something like that.
It's funny when you said that, I almost, like, my therapist brain switched. It came on, and I was almost going to say, can you tell me more about that?
I would tell you, but...
And then I had to catch myself and go, rewind, wait a minute. So, yeah, when it comes to the conversation, rather than couples or one person saying, hey, let's talk, because that brings up the red flag, almost. Okay. The we need to talk conversation, couples say that. And when that happens, what I know that happens with people is their nervous systems get activated. Mm-hmm. And they're like, oh, this is a bad thing, or what are we talking about? What did I do now? Or something to that effect. And then that usually doesn't go well in the conversation. So just like in the bedroom, I think couples getting ready to have even a conversation need to set the stage.
Okay.
Meaning, make sure everyone's, if you have kids, make sure the kids are asleep. Set some time aside in the evening, not when you're both exhausted. So don't have this conversation at 10 or 11 o'clock at night, unless that's your morning time.
Okay.
But don't do it at night. And make it when when people have privacy and they have, the space to be able to have that conversation. And, what's best is for somebody to, rather than ask their partner, how do you think it's going? How do you think our sex life is going, right? That's a loaded question. It's better for somebody to say, this is how I'm feeling about our sex life. This is the things I want to explore. I'm noticing my libido or my sex drive, or that's the best way to start that conversation.
Okay, so you shouldn't say, I think we need to see a sex therapist.
Well, that can come, but later. That might come
but
later.
Don't start out that way.
No, you don't have to start out that way.
Okay.
There's definitely reasons to go see a professional, absolutely. But not usually that doesn't need to be the start of the conversation.
So one of the questions, a lot of you guys out there, I did put on my Facebook page that I was having Madison here today, our specialist in sex. And a lot of you were afraid to put your questions in the comments, which I understand because, you may be afraid I'd say your name or something, right? I wouldn't do that. But I may say where you're from. So anyway, don't be afraid. You still have time to DM me because Madison will be back. So a lot of people were shy.
Yeah. I found that to be the case when I ask public questions or in a public forum, again, because it's not anonymous. So I found that. So it takes people some time to get used to asking those questions or feeling comfortable disclosing in some way.
Right.
Yeah, and I understand that.
But I did call my freaky friends, and they had no problem. Uh, you know,
Sure.
they had some questions for you.
Excellent.
Okay. So, one of the questions was, when you are going through menopause, how long does it take to get your libido back? Or when can you expect your libido to come back?
Well, and that's a really common question. And
Okay.
that is a great question, actually, because women really struggle with this a lot, going through either perimenopause or menopause. And to be honest with you, men struggle with it as well as they're going through andropause, is how there might be an updated term for that, but for
Okay.
men. But it's basically when men and women go through a lack of hormones.
Mhm.
And so there's a change in their endocrine system. And as a result of that, your sex drive kind of sometimes takes a nap.
Mm-hmm.
And that's really hard to get that back. And what I think is people should actually go see a physician and get their levels tested.
Yes.
So when
That
people
makes
do
sense.
come into my office, I'm always thinking about a tree. Tree, it's a diagram, right? It's in the protocol. So I think about what I need somebody to do in terms of their physical health, and then what I need to do in terms of their sexual health, mental health.
Okay.
And it's always easier to have the physical health things done, which are tests. Go see your physician, go see either your OBGYN, a functional medicine doctor that specializes in hormonal health, endocrine health,
Mm-hmm.
and then as well as for men, a urologist.
Yes.
Yeah.
Okay.
And then have those things done. And if there's a lack of hormones taking place, then those can be replenished with the physician's help, and two people, the doctor and the patient working together with that. And that will help. But also, too, when women are going through perimenopause or menopause and their libido's lacking, just like with your sex life or all areas, I try to think of it as a wheel of health.
Mm-hmm.
And it's lifestyle choices. It's what you're putting in your mouth, whether it's food or drinking, eating or drinking, right? And it doesn't have necessarily be alcohol. It could just be soda pop or whatever. So those things. Are you getting enough sleep? Sleep is a real indication of your health and how you're resting at night, so that how you feel the next day. Stress management is another part of that wheel of health.
Okay.
And then
exercise.
Yeah, I was going to say physical activity.
Mm-hmm.
But then also part of that is some self-care. So do you take any time for yourself? Do people take any time for themselves? Are they just going and giving to their jobs, giving to their family, and not really taking any time for themselves? Because if they're not,
Mm-hmm.
then there's not much left at the end of the night to give to somebody else.
Right. Okay.
Yeah, and if your cup's empty, then you can't share it with anyone because
Right.
it's empty. You haven't even replenished it yourself.
Mm-hmm.
Yeah.
So what do you do if you are peri or post or menopausal? What do you do? When can you expect it to come back? Say you went to the doctor and you've done all those things, right?
Yeah.
Now you realize that it's you or it's them. It's the relationship. How do you get that spark back?
Well, it starts with a conversation.
Okay.
And that's not the most sexy thing, I get it, but it does start with a conversation.
Okay, can we role play?
Yeah,
Maybe.
yes.
Honey, I want to talk to you about how
Sure.
I've been feeling lately.
Okay.
And I feel like we haven't had enough intimacy lately. And when I say intimacy, I don't mean just, holding hands and watching TV. I would like a little bit more physical interaction with you. Is that right?
Yeah, that's perfect.
Okay.
Excellent. Good
And
job.
then what do you say?
Let's go. No.
In a perfect world. Yeah.
And actually, I love that you clarified that it's not just hand holding, because
Okay.
saying intimacy, it's appropriate, but that could be, well, we went to the movies last week and we cuddled on the couch, And when we went to dinner, we were holding hands. So those are intimate activities, but that's not what you're asking about. So
Right.
it's great to clarify.
I want to go from first to second to third to home base. Yes.
Yeah.
Okay.
And sometimes it can be that you just make a date. I really do think people need to put it on their calendar, and I get a lot of feedback, and actually pushback is the word.
Okay, pushback. Okay.
Because everyone says that's not sexy, it's not spontaneous.
But it gets you away from the norm. It gets you away from the kids. It gets you away from your in-laws or your mom or whoever may be at home.
Correct.
I don't know. And it's just the two of you.
Correct. And it doesn't mean it has to be a sex date, but it's a time that you set aside to be with your partner.
Mm-hmm.
And it might just be reconnecting. But maybe the next week you do have sex.
Right. Or people watching.
Correct.
Yeah.
And in terms of what activities, being more adventurous, so talk about that. Is there anything you want to try? What have we done in the past that we both really enjoyed? And what are some things we might want to try in the future that is new for us?
Mm-hmm. So tell me, we talked on the phone before you came onto the show, and there was a question asked by my husband. And I'm just going to put it out there. His question was, I said, honey, I have a sex therapist coming onto the show. Do you have a question? And he says, yeah, ask how to make it better. What? I was insulted. What are you trying to say? But when I told you that, you told me what?
I don't remember exactly what I said.
Okay, you told me that there's a difference between maintenance sex.
Yes.
And
other sex, or
okay.
in adventurous sex, or play for sex. So in relationships, and once the initial part of the lustfulness or that beginning part of a relationship, once that wears off, couples do fall in a longer term lasting love, which is ideal. That's what you want. But in the transition of that, there should be maintenance sex, and maintenance sex is great for relationships. It doesn't have to be perfect. It might be a quickie. It might be in the laundry room. It might be when the kids are at a play date, whatever. That's what that is. But the other times, couples should make it more intentional. Sex should be more intentional. The time that they spend together and the time that they're devoted to each other. And whatever that the couple enjoys, they should be doing that. And that might be going on a date. It might be having a night at home.
Getting a massage.
Yes, so absolutely. So the great thing too is massages are a great way to get to know each other again without your clothes on. And it doesn't necessarily have to be sexual, but it's quite intimate.
Yes.
And it's where couples can start to explore each other. And
or
again,
fall asleep.
Yeah, that can that could happen.
I usually fall asleep.
And the other tip I will say too, when it comes to date night, is plan the sex at the beginning.
Oh, okay.
So get ready. I think you should get ready for like you're going out.
Okay.
But instead of going out at 3:00 in the afternoon, you plan your sex date. And then after that, you get ready again. And if you need to freshen up, and then you go on your date.
Okay.
Because most of us have sex afterwards and we're exhausted.
Right.
Listen, nobody wants to have sex after drinking wine, having spaghetti, having a steak. Like no one wants to go home and get freaky after having a big meal, right? It's just
okay.
It's
sure.
It's wonderful if you have that energy.
Okay, well, sex before, sex after.
Yeah.
Okay, I like that.
Yeah.
So, let me think. There was another question, and all my questions, for some reason, are not in front of me. But the one was about the menopausal, the other was how to make it better. And then, and I just brought it up in conversation. The other question that I received was how to, we started out the show with this, was how to get the other person to engage.
Yes.
Okay, so how do you get your spouse to
like initiate? I just want that's what you're talking about, right? Initiating. Okay.
Right. Because this person that I was speaking to, they were saying that their spouse used to initiate and now they don't anymore. And I think it sounded to me like they wanted that same pattern.
Mm-hmm.
But I guess things have changed, right?
Yeah, absolutely. And that's also, I want people to be open to that how it was at one point in the relationship may not be how it is now.
Right.
Because we change, and we change, everything changes, except as adults, we don't really see our partners changing so much. We kind of put them at a placeholder when we first met them,
Mm-hmm.
and we kind of always are looking back at that, and that's like the marker. But it shouldn't be, because
But you can have the conversation.
Yes, absolutely.
Baby, you remember when you used to, and I want to tell you, I really liked when you used to. Can we try that again?
Yeah, absolutely.
Okay.
That was brilliant.
I'm getting an A in sex.
Yeah, well, and it can also bring in, do we want to do some of that? That's familiar. So then, yeah, that can be. But I would also ask, did that not work? What about that didn't work, and why did it stop?
Okay.
So then maybe there needs to be some exchange of power, a different power dynamic.
See, you're lucky we're on public radio. However, if you'd like to stay tuned, you're always welcome to go to my YouTube channel, and we can have a deeper conversation about sex. Okay?
Absolutely.
So all you need to do is go to itswhereiam.com, and we will continue the conversation about sex, and then we can say some words that we can't say on air. Okay?
All right.
So now I digress. Back to the education and helpfulness of sex, mental health,
Mm-hmm.
and relationships. Okay? So, what is something that you want to give to our listeners? What's a nugget that we can all use that has not been said already?
I want to say it, but maybe I can't say it on the air. So let me.
Well, what is it first?
Well, solo pleasure.
Oh, okay.
I think everyone should be doing.
We got to guess. We can say it. Solo pleasure.
Solo pleasure.
Okay.
It's a solo practice, really, and a lot of people don't engage in that, or maybe life has gotten really busy, and that can happen with just, again, different transitions in adulthood. So people will forget, their own pleasure and well-being, and if they're not engaging with sex with their partner, then they don't even engage with the sex with themselves. So again, solo pleasuring.
Oh, wow.
So especially for men and women, if you don't use your equipment, you will lose it. Like, there's some atrophy that starts to take place.
The equipment in the drawer or the equipment that's attached
on your
to
body.
Us? Okay.
Yeah. So men's erections will actually decrease over time if they're not using them regularly.
Oh.
That, and then also if women aren't because women self-lubricate. That's what we do. So,
right.
And when we're turned on, there's more lubrication.
Right.
So if a woman is not engaging in sex in her personal life, then
she dries out?
Well, no, not necessarily. I mean, that could happen, absolutely.
Oh,
and then, of course, with hormonal changes, women become a lot drier or very dry, and that's a problem. So, engaging in solo pleasuring can really keep those juices active.
Okay.
And that's really healthy for a woman's sexual health, just like it is for a man's sexual health. I have a little bit of a disclaimer: don't use porn.
Okay.
There's a time and place for porn, but during this, that's not the time and place.
Okay.
And also, too, just because a man loses, like, he might lose some of his erectile tissue, it doesn't mean that women need to be giving it up all the time, or he needs to be going and solo pleasuring 5 times a day. Like, that's not what I don't want any of your audience to read into my words. Like, I'm talking about a healthy engagement with your sexual self.
Okay.
Yeah. So
why do you say no porn?
So there's a lot of reasons, but porn really is like cocaine for the brain. Okay. And when an individual watches porn and watches too much of it, they're seeing and searching for exactly what they want, and they're getting that every time. And no one in real life is that. Whether it's that lighting looks that good, sex is always perfect, bodies are perfect, everything, like, it's Ridiculous.
Excuse me.
And so if people watch that, whether it's men or women, because a lot more women are watching porn these days, but again, that's not this average. That's not the average. And so when we find porn that visually we like and it's really stimulating, it's arousing, but it's also mentally stimulating as well. And normal sex is just not that every time. It might be like that 1 in 10 times, 1 in 5 times if you're lucky, which is brilliant. But that doesn't mean it's every time. So people's expectation of what they're seeing and what they're having is very different.
So that's going to affect your sex life with your partner.
It will, absolutely. It absolutely will, because it's either an individual may not be turned on like they are when they're watching something.
Right, like instantly?
Yeah.
Okay.
And our bodies are like preheating an oven. So our turn on and arousal is literally like preheating the oven. And that's why foreplay is so important. That's why sensuality and eroticism and playfulness and all of those things are really, really important to preheat that oven so that when you get to the bedroom, it's a continuation of that. You can just turn the heat up more.
Okay. Well, you heard it here. It's where I am. I'm Zandra Pollard. I'm here every Saturday at 7:30 a.m. Also, you can catch me on all your podcast platforms, Apple, Spotify, Google, whatever it is, I am there. Just go to the search bar and type in It's Where I Am with Zandra. So, we'll see you next week and have a great day. Bye. This is the after show. Now we can talk about fellatio.
Okay.
What is it called?
Cunnilingus.
Cunnilingus. So.
Yeah, and the word I was going to say was jerking off. I don't know if I could say that. Because that's the word I use. I'm like, no jerking off 6 times a day. I had to remember, okay, wait a minute.
So, okay, why is it that the same sex can do it better than opposite sex? That seems to be what's...
You mean in terms of like critique, like...
yeah, like, okay,
experience, so like, not experience, but hitting the right pleasure points? Is that what you mean?
Yes.
Well, I mean, they're just more familiar with the equipment.
Right.
So there's that. But same-sex couples, well, listen, so if, in terms of, like, I'm a woman, I know what women like. Not all women, for sure. But I also know how to please a woman, and the way I am erotically with women is very different than I'm erotically with men. And I like both sexes. So I'm going to even pick up a woman very differently than I would pick up a man. And so I think that's really important too. And I know that how I am with men is I'm probably be more aggressive. That's my personality style. So I'm more aggressive with men. It doesn't mean I'm dominant with them, but I'm definitely a lot more aggressive. Where with women, it's more about usually sensuality and eroticism and
so like
flirting.
With a woman, you're doing what you would want in every way.
Yes.
Okay.
And what I've heard that happens, or what women have described to me, is that men end up being with them in a way that simulates porn. And most women don't like to be effed that way.
Right.
They just don't.
Okay.
That's sure, maybe scattered throughout or sprinkled throughout the session with somebody, that's fine. You can do that. But most women don't want to be pounded for 25 minutes. It's not sport effing. That's what I call it. And to be honest with you, women can fake orgasms really well.
Oh yeah, we get down.
Yeah, and yeah. I don't want them to. I don't condone that, but sometimes it's
get off of me.
Yeah. If they're getting that and that's not really the kind of sex they want,
right?
And they don't really. It's hard to say.
But there are some women who do.
No, and correct, but majority of the time, a woman's not necessarily having an orgasm from that kind of activity.
Right.
It's a little bit different. Sometimes there's just so much stimulation with that activity that it's hard to kind of narrow down, okay, the for women to have an orgasm, it's much the makeup of the stages of orgasm are the same for both sexes. However, the mechanics of women getting and being in their arousal up to orgasm is very different than the way that men's mechanics are.
Right.
Yeah.
Well, I just wanted to make sure I said those few words. And then also, we talked about BJs.
Yes.
Okay. So with the BJs, okay, I'm not going to lie, I get tired. I get tired. And my husband sometimes is like, okay, well, can you keep? And it's like, no, my mouth hurts. I don't want to keep going. So I try to okay, I'm going to do it for 30 seconds extra. I challenge myself to give it more time, but it's hard. You get the TMJ and stuff.
Sure, absolutely. Yeah, I mean, there's a great line from Sex and the City, and Samantha says they don't call it a job for nothing. We're breathing through our nose. We're sucking. We're looking sexy. It's all these things, and it's just it's difficult.
Yes.
So women should use their hands, and there's also tools that you can use, whether it be erotic sleeves. There are sleeves that can assist with blowjobs. So you can, you can have a sleeve is both ends. So you put the cock through, and then that can also be at the base while you're just at the top.
Oh.
And then use your hands as well, so that it's not just your whole mouth doing the work, because your jaw is going to get tired. Yeah. And then also body positioning is really important.
Yes.
Most of the time women don't think about their body position and how long they're going to be in that position. And so make it comfortable for you. Okay. Either a pillow under your knees, or you're upright, you're not leaning down and nothing upside down, give me a break. Off the side of the bed upside down, that doesn't work either. I mean, it might be for a change up. That's great for 5 minutes or something.
Right.
But, and then also too, women need to control the man. So don't let him thrust into your mouth, because that can choke you.
Right.
And so that's not good either. So a woman needs to be able to control him so that it doesn't go down too far and too deep, so that she's not gagging and hurting.
But I have to say, I think sometimes men like when you go, oh.
Well, they do love it because they watch it in porn. It's freaking ridiculous.
Oh, okay. That's what it is?
Yes.
Oh, okay.
No woman wants to have saliva and spit running down her face, her mascara running down her eyes, and it all over her chest. That's not
sexy
at
all.
It's not.
Okay.
No one likes that.
Well, you heard it here. It's where I am. Do your BJs right. Get the sleeve. That's a new one for me. I'm going to look for it today.
Well, also, too, the other thing is mouth lube.
Oh.
So
I'm sure it comes in flavors.
Well, the one that I particularly like is just a general lubrication, but it's odorless, flavorless. It's not sticky. And I think it's great for using mouth lube, because sometimes I don't even have a lot of saliva.
Oh, okay.
And instead of waiting for it to kind of happen, and it happens by having the cock a little bit deeper in your throat, and then you'll activate your salivary glands. Okay. But you can use a lube, and there are lubes that are definitely flavors, but again, I would make sure that it doesn't have any byproducts in it, right? Make sure that it's really clean and safe, so no plastics or BPAs or paraffins, that kind of stuff.
Okay.
And the one that I particularly like, again, it's odorless, flavorless. Oh. It's all of that. It won't leave a stickiness in your mouth, and you just need a couple squirts of it, and it's wonderful. Yeah.
Okay, so I know you have something for our listeners who may be watching on YouTube, and so what did you want to say?
Yes. So what I have, I'm actually launching a sex coaching website. Okay. So I'm moving out of the therapy world, and I'm going to be doing sex and relationship coaching. Okay. And so my website is my name, MadisonGully.com. And what I have for them, it's a membership site, and every month I teach a masterclass around a sex skill. Okay. And it's quite intensive. So there's 4 weeks.
So like a skill like we just got right now.
Absolutely. Except every week is a different, breaking down that skill into different parts. Okay. And then also bringing in a member's journey into that month. So people will sometimes let me interview them or talk to them about their experience. And they don't have to use their real name. Sometimes I even make the camera so it's just at their neck if they don't want their identity exposed. Okay. To make it really anonymous for people.
If you see this neck, it's me.
And so what what I have is a discount code. So it's a 50% off discount code. And it's actually 91.5 Jazz is the discount code.
Okay.
So 91.5 lowercase j.
Well, that's nice.
Yeah.
It should have been It's Where I Am.
It should have been.
But next time. How about that?
Yes.
All right. So I want to thank you again for coming on.
My pleasure.
Thanks for staying for the after show. And of course, please come back.
Absolutely. I would
All
love
right. Let's talk about more sex. See you next time. Bye. We're talking sex, baby. Sex, sex, sex. Did you get sex?
Yes, we are
Can
talking
you hear
sex.
me? Saying
Sex in relationships.
EX. Sex. How's that for a mic check?